This work was proposed as a translational study based on some laboratory work that we had been doing. We had spent many years focused on the role of JAK inhibitors for the treatment of graft versus host disease. And it is an important inhibitor of acute graft versus host disease in mouse models of GVHD. And obviously now ruxolitinib was the first drug approved for the treatment of steroid refractory acute graft versus host disease. And so it is by blocking gamma interferon signaling and by blocking IL-6 signaling, we think it plays a role in acute GVHD and now probably also chronic GVHD. So we thought that perhaps the inflammatory state seen in GVHD could be recapitulated in CRS. And so we did a study. The study is actually, it was done just at Washington University, where patients on the flotetuzumab study were given ruxolitinib in preparation for the DART, which caused CRS in a high percentage of patients. So our hypothesis, based on some laboratory work showing that JAK inhibitors were important at blocking the production of IL-6 in a in vitro CRS model that we had developed in the lab that we go into in the abstract a little bit, that would be an effective way to block CRS without altering the function of the dual affinity retargeting agent as far as anti-leukemic effects. So that was tested in a very small population of patients. And what we found is that in spite of a number of cytokines being profoundly reduced, interestingly, that the clinical rates of CRS and the overall outcomes of the patients was not different than historic controls. So there's two explanations for this. One is that our in vitro model is not predictive of what's happening in patients, and it's not a good surrogate model for real CRS when patients are given a bispecific agent, or that the pharmacokinetics of the drug are not persistent enough during the entire day so that those pathways are not completely inhibited adequately enough with an oral medication like ruxolitinib. So I don't know what the answer is, but certainly it does block the production of a number of cytokines. But interestingly, the levels of IL-6 were probably the least reduced of all cytokines. And so that may explain why we didn't see any major clinical benefit. This is also being tested using a different JAK inhibitor in the CAR T cell setting. This study is being sponsored by Incyte. And so in that study, itacitinib, a JAK1 specific inhibitor, is being given to patients undergoing CAR T cell therapy. And those studies are ongoing, and we'll see what they show. The study's sort of in the middle right now, and that's a multi-institutional trial as well. So the concept of JAK inhibitors blocking CRS is a very interesting and concept that's being tested in the setting of bispecifics, which we did in this very small study, which we couldn't see an obvious effect, and in the setting of CAR T cells, which is a much bigger multi-institutional study, and the results of which I don't know yet.